Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
The next type is membranous glomerulonephritis. Membranous glomerulonephritis. Membranous glomerulonephritis, more commonly it occurs in the adults. Membranous glomerulonephritis more commonly occurs in the adults. This membranous glomerulonephritis is of two types. One, we have primary membranous glomerulonephritis and secondary membranous glomerulonephritis. Primary membranous glomerulonephritis mainly includes the idiopathic cause. This primary membranous glomerulonephritis is no more applicable. It is seen in 75% of cases, whereas secondary membranous glomerulonephritis is seen in 25% of cases. So, first we will see secondary causes of membranous glomerulonephritis. The secondary causes of membranous glomerulonephritis can be due to hepatitis B virus and even hepatitis B virus, and hepatitis C virus is also associated with membranous glomerulonephritis, malaria, leprosy, syphilis. This syphilis can be either secondary syphilis or congenital syphilis. Then we have schistosomiasis, filariasis, then hydatid disease or enterococcal endocarditis. All these are associated with secondary causes of membranous glomerulonephritis. Then we have tumors. Tumors causing membranous glomerulonephritis are colon carcinoma, lung carcinoma, stomach carcinoma, esophagus carcinoma, melanoma, renal cell carcinoma, neuroblastoma, carotid body tumor, breast carcinoma, carotid body tumor and breast carcinoma. So all these are associated with uh, membranous glomerulonephritis. Then we have autoimmune conditions. Autoimmune conditions which are associated with membranous glomerulonephritis include, we have rheumatoid arthritis, autoimmune conditions like systemic lupus erythematosus, rheumatoid arthritis, Hashimoto's thyroiditis. Then we have Sjogren's syndrome. Then we have Sjogren's syndrome or Graves' disease. Then we have mixed connective tissue disease, or we have primary biliary cirrhosis, or it can be due to ankylosing spondylitis, dermatitis herpetiformis, bullous pemphigoid, myasthenia gravis. So autoimmune conditions like systemic lupus erythematosus, rheumatoid arthritis, Hashimoto's thyroiditis, Sjogren's syndrome, Graves' disease, mixed connective tissue disease, primary biliary cirrhosis, ankylosing spondylitis, dermatitis herpetiformis, bullous pemphigoid and myasthenia gravis. So all these are secondary causes of membranous glomerulonephritis. Then we also have drugs. Drugs like penicillamine, probenecid, NSAIDs, mercury, gold. We have trimethadione, then chlormethiazole. So these are the drugs which can cause the glomerulonephritis, membranous glomerulonephritis, like gold, penicillamine, probenecid, NSAIDs, mercury, um, trimethadione, chlormethiazole. Then we also have miscellaneous causes which are responsible for membranous glomerulonephritis. These miscellaneous causes include sarcoidosis, diabetes mellitus, sickle cell anemia or sickle cell disease. Then we have Crohn's disease. Then we have Guillain-Barré syndrome. So all these are associated with membranous glomerulonephritis.
Thank you and thank you for watching.